Thank you for joining us today on KZSU Stanford 90.1 FM for our 5-minute technology news update. Our update today is from a company called Viacyte. Viacyte is a leader in the field of regenerative medicine, and they have invented a new stem cell-based product called VCO1 that has helped cure diabetes type 1 in the animal model. Viacyte spent more than 15 years of hard work to develop VCO1. And in 2014, they were rewarded by an FDA approval to test VCO1 on human beings. Today, VCO1 is in clinical trials in both the United States and Canada. If you would like more information about these clinical trials, please visit clinicaltrials.gov, and when you get there, please search for Viacyte or VCO1. The website again is clinicaltrials.gov. Today, we had the honor and privilege of interviewing Dr. Paul Laikind, Viacyte's CEO. Dr. Laikind is considered by Stem Cell World as one of the top 50 most influential leaders in the world in the field of stem cell technology. In today's interview, Dr. Laikind described to us how VCO1 works and how it might help treat patients with type 1 diabetes.
VCO1 is really composed of two parts. The first is a stem cell-derived cell replacement product. So we take that embryonic stem cell and through a directed differentiation protocol that was developed over the course of many years within the company, we're able to take that stem cell and drive it up to a pancreatic cell, what we call a pancreatic progenitor cell. The second part of our technology and our product is a encapsulation technology that we call the encapsulated drug delivery system. And probably the easiest way to think of it is like a tea bag. We put the cells in this device, and then that is administered by implanting it under the skin. The cells are contained within the device. They cannot escape, but there's a semi-permeable membrane that allows the free flow of nutrients and oxygen and proteins. Over a period of time, the cells continue to differentiate and become, for all intents and purposes, islets under the skin, producing insulin and glucagon and somatostatin under control of the blood glucose level of the patient.
How do you think VCO1 will benefit patients with type 1 diabetes?
What we expect will happen based on what we see in the animal models is once we implant the VCO1 product under the skin, those cells will continue to differentiate and become beta cells and alpha cells and other cells of the pancreatic islet, and will sense the blood glucose levels in the patient and appropriately release insulin and other factors to control blood glucose to normal physiologic levels. So what we hope happens after we treat a patient with VCO1 is that during that time where the cells are differentiating and beginning to produce insulin, they will require less and less injectable insulin until, if we're completely successful, they will essentially be able to throw their needles out the window and be independent of the need for exogenous insulin. And so that's why we call it essentially a functional cure. For all intents and purposes, if this works as well in the patients as it has in our primary animal models, then it will essentially be a cure for type 1 diabetes.
Thank you for joining us today for our 5-minute news update. And if you would like more information about Viacyte or VCO1, please visit Viacyte's website, Viacyte.com. If you would like a copy of today's broadcast, please download it from our website, moderntechnews.com. That's moderntechnews.com, and please follow the link to Technology News.